In this video, we discuss the role of ozone during cancer treatment. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101 – Quick Tips to Help You Survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. Ozone, O3, is formed when oxygen is subjected to a strong electrical charge. For instance, an ozone machine subjects pure oxygen to charges between 5,000 and 15,000 volts. Lightning strikes can also produce ozone. In fact, the word ozone comes from the Greek for to smell. The discoverer of ozone, Christian Friedrich Schönbein, recognized the smell of ozone as being the smell associated with a lightning strike. Strong electrical charges pull apart the O2 molecules into singlet oxygen, some of which recombines into ozone, O3, molecules. Ozone is highly unstable and has a half-life of only 7 to 10 minutes under normal indoor conditions. Because O2 is much more stable than O3, O3 very eagerly donates an oxygen atom, making it an extremely powerful oxidizing agent, much more so than O2. This donation of reactive oxygen atoms can inhibit cancer by itself, or synergize with other treatments that raise reactive oxygen species, ROS. Ozone has a variety of other mechanisms of action against cancer besides increasing ROS, including immune modulation and vasodilation with improved oxygen delivery. In fact, 3 ozone treatments on alternating days were found to increase blood flow by 75% through the carotid artery in the neck and by 33% in the middle cerebral artery in the brain. These improvements were long-lasting with sustained improvements in blood flow a week after the last session of 29% and 18% respectively. Ozone is also a modulator of blood antioxidant capacity. In healthy individuals, ozone administration led to an increase in antioxidant status, whereas in individuals with cancer, it lowered blood antioxidant levels. This is a desired outcome as cancer uses antioxidants such as glutathione to defend itself from cancer therapies, which typically work by raising reactive oxygen species levels. See our video on antioxidants. Ozone can be administered via many routes. The most robust method is autohemotherapy. Autohemotherapy consists of extracting blood from the patient, normally 200 milliliters, infusing the blood with ozone, normally 8 milligrams, and re-administering it to the patient. This method avoids the possibility of an embolism that may come from injecting O3/O2 gas directly into a vein. Extracorporeal blood oxygenation and ozonation, EBOO, is an efficient version of autohemotherapy that is able to ozonate a large amount of blood. Although injecting ozone gas directly into a vein is strongly contraindicated, injections of ozonated saline and ozonated water have shown signs of efficacy in humans. Normal concentrations of ozone used in water or saline injections vary between 50 to 100 microgram per milliliter. 250 milliliters of ozonated saline with a concentration of 100 microgram per milliliter was found to cause pain in the vein used in healthy volunteers. For surface injuries, such as chronic infections or ulcers, administering ozone over the area inside tight polyethylene bags has been shown to be effective, even roughly halving the number of limb amputations needed in chronic limb ischemia, a disease that reduces blood supply to limbs. The method that is probably the combination of most effective and most convenient for home use is typically rectal insufflation, during which ozone gas quickly enters the bloodstream through the veins in the rectum. In a rectal insufflation procedure, Ozone gas is stored in a specially designed bag. As ozone is quite reactive and can degrade most bags, then a catheter is inserted into the rectum and the gas is released. This method is about 80% as effective as autohemotherapy and can be performed at home with the instructions of a medical professional. For adults, the amount of gas typically administered is 150 to 300 milliliters with ozone concentrations of 10 to 25 micrograms per milliliter. This procedure is performed 2 times a day or less. Many times, patients who are having trouble getting their veins to give blood find rectal insufflation an acceptable substitute. All of the equipment needed for rectal ozone is sold online in kits. Another route of administration is drinking ozonated water, 200 to 300 milliliters of freshly ozonated water on an empty stomach. Ozonated water can also be applied topically. Additionally, ozonated olive oil can be applied topically or ingested. Ozonated olive oil has been consumed orally in doses as large as 12.5 milliliters 2 times a day in human cancer trials with positive results and minimal side effects. An oil, such as olive oil, is able to retain the ozone for much longer than water, making it a much better carrier. Ozonated olive oil could be made at home by leaving a commercial water unit running in a container of olive oil only a few ounces in size for 24 to 48 hours. Additionally, ozonated olive oil can be purchased pre-made commercially. Commercial ozonated oil is generally of a higher quality than homemade. A combination of ozonated water and ozonated olive oil has even been nebulized in a human trial without negative side effects and signs of efficacy. One manufacturer, Puro 3, states that ozonated hemp oil can contain about twice the ozone as olive oil. They recommend ozonated hemp oil for oral consumption. They even sell a soft gel, and ozonated olive oil for topical application due to its ability to penetrate tissue deeply. Ozone or ozonated water can also be applied intravaginally. Ozone gas should not be inhaled, as it can cause lung inflammation. Ozone that is produced just from air is likely to have impurities in it. Ozone that is administered to humans should be produced from pure oxygen rather than air. Ozone has shown strong anti-cancer effects in human and animal trials. Even ozonated water can have a strong anti-cancer effect. In this animal trial, the NT group received no treatment. The C group received an injection of sterile distilled water into their tumors, while the group received an injection of ozonated water injected into their tumors. Another trial in 90 rabbits examined the effect of ozonated saline injected directly into tumors. Group A, the group of rabbits that had saline injected into their tumors, had the highest growth rate, while groups B and C, which had different concentrations of ozonated saline injected into their tumors, both show a significant decrease. The effects of ozone in humans are equally as impressive. A 2022 trial showed the power of ozonated oil during cancer treatment. 115 advanced cancer patients, including 22 with primary brain tumors and 18 with pancreatic cancer, were given ozonated olive oil in cellulose pills as a therapy complementary to standard of care. The leftmost column says full recovery. The next says downstaging. Next says stable diseases. Next is progression. The rightmost is deceased. The complete response rate was nearly twice as high in the ozonated oil group as the standard of care group. There was over a 3 times greater partial response rate, and the mortality rate was less than a fourth in the oil group than the standard of care group. An initial 7 patients were used as test subjects before the trial in 115 people began. These 7 people, 2 of whom had glioblastoma, had as impressive results as the 115 who followed them. These 6 of these 7 people actually ingested ozonated oil orally, not in capsule form. The dosages were typically about 12 milliliters 2 times a day. The very first patient actually had her ozonated oil applied topically. She had an incredibly large radio-resistant basal cell carcinoma protruding from her head. It had developed very rapidly and was certainly soon on its way to being fatal. Radiation was commenced, along with topical application of ozonated olive oil, gelled at 4 degrees Celsius. Colder ozonated oil has a longer-lasting effect after the radiation. The carcinoma was then coated with a gauze and a bandage. This continued for 8 sessions, 1 every other day. Radiation was then suspended because the patient's caregiver could not bring her to the hospital more than once a week. Yet topical treatment with ozonated oil continued. The results are shown in the following images. This incredible life-saving improvement prompted the scientists to look at the patient's blood work to see what kind of effect this topical ozone was having systemically. They found the oil had increased the patient's reactive oxygen species by 530% and decreased her antioxidants by 13%, showing proof that ozone can synergize with other pro-oxidant cancer therapies. This brave experiment, although the scientists admittedly stand on the shoulders of giants, has proven the viability of ozonated oil as a promising cancer treatment. 31 cervical cancer patients were pretreated with rectal ozone insufflations before chemotherapy and radiation, and 22 patients were used as controls. The ozone group had lower side effects across the board, including a 22% rate of leukocytopenia, a decrease of white blood cells, compared to 72% in the control group. Ozonated saline concurrent with standard of care treatment in 48 women with stage 3 to 4 breast cancer improved overall and recurrence-free survival relative to controls. A study in 70 men with prostate cancer found that rectal insufflations of ozone concurrent with radiotherapy decreased prostate-specific antigen, PSA, numbers and side effects more greatly than radiotherapy alone. 23 people with metastatic colon cancer underwent treatment with Avastin, an angiogenesis inhibitor, FOLFOX4, a chemotherapy regimen, a transfer factor immune modulator, and ozone therapy treatment. 7 people had a complete response, 13 had a partial response, and 3 had stable disease. This is a far better result than would have been expected with standard of care. Ozone therapy is often used for improved wound healing. One study of 28 cancer patients with delayed wound healing, an average of 48 days, after surgery or radiation, showed that ozone therapy led to a complete healing in 22 patients and an improvement without full resolution in an additional 4. A 21-year-old Hodgkin lymphoma patient required surgery for appendicitis. The wound initially would not heal, but after 5 ozone treatments, it healed. Literally, over a dozen more pieces of human trials and case reports are summarized in the book Cancer Self-Defense 101. Ozone is easily one of the most versatile, powerful, and gentle therapies profiled in this book. The amount of ways it can be administered is amazing. It is incredibly safe and well studied. It has been used clinically for over 100 years. Incredibly, the first person to patent an ozone generator in the United States was none other than Nikola Tesla. The story of Tesla's life is the story of a genius who came up with ideas that were literally more than a century ahead of their time, only to have them summarily rejected or ignored by the public at large, despite them being correct. What did Tesla create with his ozone machines? Ozonated olive oil, which he then tried to sell to naturopathic doctors as a treatment for a variety of ailments, including cancer. Only in 2022 have we even begun to understand the potential of ozonated oil. Have we come far enough as a culture in the interceding 100 years to pay an intellectual giant his due and finally take another look at ozone as a medical treatment. For more information about ozone in cancer treatment, please see the book Cancer Self-Defense 101 – Quick Tips to Help You Survive.